Hi, so my name is Ariana, and I am going to be doing my presentation on, oops, is this sharing? Okay, I'm going to be doing my presentation today, and I will be discussing my research proposal on financial hardship among cancer patients and how limited access to financial assistance and support services can affect treatment outcomes. So the background of the problem, and I do have my notes off to the side as well because I don't really know how to talk very much and give presentations. So, um, but I just have like my notes on the side. So if I look to the right, that is why. Um, so the background of the problem is point blank period, cancer treatment is expensive. I had the opportunity to do my first practicum for 7 months at the University of New Mexico Hospital's Comprehensive Cancer Center here in Albuquerque, New Mexico. And I had the opportunity to do social work there for, like I said, for my first practicum. So I've seen a lot of the ins and outs, and I feel like the number one issue that people would come to me about was not being able to afford treatment, not able to afford, daily living expenses. Majority of it was like rent, transportation. So we would help a lot. There's a lot of programs already in place at the Cancer Center, thankfully, to help those patients get to their appointments, be able to afford their treatment and make their appointments, things like that. So we did try to make it a lot easier on patients. But the background of the problem, cancer treatment is expensive, especially if you don't have medical insurance. It's very expensive. Many patients struggle with medical bills and everyday expenses. Financial hardship can affect treatment and quality of life. And according to Ponce et al., they called it financial toxicity. So, like I said, many cancer patients, they experience financial stress due to treatment costs, medication, transportation, and just because they lose income, a lot of these patients can't work. Um, because of, they're so tired from the treatments. And there's just a lot of appointments that they have to make. And a lot of times employers don't let them, off to go to those appointments. And this financial burden can make it harder for patients to continue treatment and just maintain their overall quality of life. So, problem statement. So, one of the problem statements is that cancer patients often face financial challenges during treatment. Like I've mentioned, so like the main problem is that many cancer patients, they don't have enough financial support or resources that are available to them, and this can negatively impact their treatment outcomes and just their overall well-being. They have limited access to support services, which can increase stress. Financial hardship may lead to, like I said, missed appointments or delayed treatment. More research is needed to understand the impact that support services have on these individuals. So, my research question was, how does limited access to financial assistance and support services affect financial stress and treatment outcomes among cancer patients? So, I guess a little bit of like a personal experience. Thankfully, the cancer center that I was doing my practicum at, they have a lot of funding. So, the supervisor of the social work department, I had a patient, come up to me and she was like, she got robbed, where at the apartment complex where she was staying. And she was like, I don't feel safe being there anymore. And I need help. She was 6 months into her lease, and she was like, I need to leave. Like, I don't feel safe here. And she was undergoing treatment, and she was like, I need to pay my termination fee. I need to get out of here, and I need first month's rent, and I want to move to a more safer community. So my department is just awesome at the Cancer Center, which was the social works department, obviously, but they were able to help with funding for the termination fee, first month's rent, and then also help with like moving costs. for this patient, and they were just so, you could just see like the stress that was lifted off their shoulders to receive that help. So I just wish that a lot of other people had like that access to that financial assistance, because we can't help everybody, but just to see how much just that helped one patient, I could just imagine, if there was a program or a financial assistance program or any support services to help patients, to help all patients like that. So, literature review. So, some key findings that I found from research is um, financial toxicity is common among cancer patients. Financial stress affects treatment adherence. Support services improve access to care, and patient navigation programs help reduce barriers. And those are the articles that I used. So, the literature consistently shows that financial hardship affects cancer treatment and that support services can improve overall patient outcomes. So the theoretical framework that I chose was the systems theory, because a cancer patient's experience is influenced by many different systems that are working together. When one system fails, such as, like financial support, family, healthcare, it can affect treatment and then like the patient's overall well-being. So I just said individuals are affected by multiple systems: families, support systems, healthcare systems, insurance systems, employment, and community resources. So the methodology that I propose to use is the mixed methods approach, because it allows me to collect both numerical data and personal experiences, which I think is important in this area of research. Quantitative surveys, qualitative interviews. Population is adult cancer patients, and the sampling would be purposive sampling. So data analysis. So the software that I would be using is SPSS and NVivo. SPSS would be used to analyze the survey results, while NVivo would help identify common themes from the interviews with the patients. My independent variable would be access to financial assistance, and then my dependent variables would be financial stress and treatment outcomes. So culture diversity and oppression. So some considerations to take in are like low income populations, rural communities, minority populations, older adults, individuals with disabilities, and some barriers to think of are like transportation, insurance, language, and healthcare disparities. Not all patients, not all cancer patients have equal access to certain resources. Many underserved populations experience greater barriers to cancer care. So some ethical considerations I've taken from the NASW Code of Ethics. Researchers, they must protect participants and ensure the study is conducted ethically, while respecting the rights and dignity of, their clients, patients, as also is also mentioned in our curriculum textbook. So informed consent is important, confidentiality, protecting privacy and rights of the participants, respecting for the participants is huge, social justice, and just having overall dignity and worth of each participant. Implications and recommendations. So some implications that I found were there needs to be a better understanding of financial hardship, improve patient outcomes, and increased access to resources. The findings could help improve services for cancer patients and also be able to reduce barriers that affect treatment and quality of life for these patients. So some recommendations that I found were to expand financial assistance programs, increase patient navigation services, improve transportation support, offer financial counseling. And I think that's what would come out of this research proposal. So in conclusion, financial hardship is a significant issue for cancer patients. By improving access to support services, expanding financial assistance programs, resources, healthcare providers, and social workers can help reduce barriers and improve treatment outcomes for individuals with cancer, with a cancer diagnosis. Financial hardship affects many cancer patients. Support services can improve outcomes. More research is needed. Social workers can play an important role in connecting patients to resources. These are my references. And thank you so much.